I want to thank SEIU and the Center for American Progress for putting this event together. And my first thoughts, and Barbara, my wife's first thoughts today, are for Elizabeth Edwards and the Edwards family in this very trying time. And if there's one message about a policy message relating to this situation, is that as Americans we should spend more, invest more in cancer research, in the National Institute of Health, and many of our entities that are underfunded and with flat budgets. We should invest more in stem cell research. We should find ways to invest in the diseases in this country. We as Americans are in crisis today. As a governor, I have to deal with the healthcare crisis every day. We got a problem with increasing access, coverage, and controlling costs. Since the year 2000, healthcare premiums have increased for American families by 80%. 4,000 Americans lose healthcare coverage every day. We spend $2 trillion on healthcare. 31% of healthcare costs are spent on bureaucracy and red tape instead of direct care. It is critically important that we devise a strategy, first of all, that doesn't create any more bureaucracies. We have enough bureaucracies. And as a governor, I've been able to control costs. I've even cut taxes for working families, and at the same time expanded coverage. So what would I do as a president? First, to deal with increasing coverage. Number one, all Americans and all businesses should have the same coverage, should be able to purchase coverage as members of Congress and the President of the United States. We need to do that, and we can do that. Number two, I would start something new. Americans 55 and older should be able to purchase coverage through Medicare. Today it's at 65. Number three, a trade, and this is how a governor would operate. The federal government, Medicare goes to treat seniors and the disabled in exchange for the states dealing and increasing Medicaid coverage for children and families. And number four, veterans. We should give our military veterans the access they need anywhere they want, anytime they want. And I would have a hero's health card that would enable our veterans, when they get out, to get coverage, choices anywhere they want. They should not have to drive 200 miles to the nearest VA hospital. Now, this is how I would deal with coverage. What about costs? I would have a cooperative plan between the employer, businesses, the state, and the federal government. I would propose a refundable tax credit for those Americans that need coverage based on income. Number two, I would clamp down on credit card companies that are covering excessive interest rate costs. I have a health secretary who, her brother is paying 18%. A lot of Americans pay their health care through credit cards. 18% interest rates. I would put a cap on those costs. I would also make sure that we have a prevention strategy. Early prevention. Kids. As a governor, I eliminated junk food in schools. I just signed a statewide smoking ban, and I would do that as president. I would have a promotion of healthy lifestyles, give tax credits to companies that encourage their workers to be healthier, to exercise. I would also make sure that we have a strategy to deal with the 31% of excessive healthcare costs and bureaucracy by electronic records. I would also find ways to ensure that we have an answer. How do we pay for this? This is how I would pay for this health care plan. Number one, we reorder priorities in this country. We get out of Iraq and put the $400 billion that we have in Iraq and shift it to human needs. Number two, we spend $2 trillion on health care. We shift and reorder priorities in terms of reducing inefficiencies in our system. And number three, we would offer options for all Americans to get health care coverage. Workers must get health care coverage. But you help them. But you help them if they need it. And businesses and small businesses have to participate in health care plans for all those employees. That's what I would do as president. This is a plan that would not add bureaucracy. This is a plan that could be paid for without any new taxes. This is a plan, I believe, that says to the American people, if I have a health care plan and I'm satisfied with it, I can keep it the way it is. I believe also that as Americans, we have to ensure prevention. That is so important. Making sure that we start early. Making sure that we promote healthier lifestyles. That would be my plan as president.